Hello everyone, welcome back to the course on Health Humanities, Indian and Western Medical Knowledge Traditions. This is lecture number 51 on comparing Indian and Western classical medical traditions. In this lecture, I will talk about healing traditions across cultures, both Indian and Western cultures. I will talk about how Indian and Western medicine emerged, what were their historical as well as cultural and social contexts, and how they proliferated in those contexts and cultures, and how society played a major role in determining the healing traditions, the medical traditions of Indian and Western traditions. I'll briefly compare them and then focus in detail about magico-religious, social, and normative elements of medical traditions in both cultures. When we look at the importance of understanding different systems, and then we find that global health perspectives needs an interconnectedness of health systems worldwide. These interconnections of different systems provides better medical care. It also highlights the disparities and gaps in them, which can also opens up the space for collaborative approach that can help in combating health challenges. And when we think about the different systems, we cannot ignore the cultural beliefs, cultural practices, because they influence the healthcare system significantly. They influence the patient's experience. They influence the way one is getting medical facilities, and it shapes their understanding and perception of medical care. In this way, the understanding of different cultural beliefs and practices helps one to understand the disease perception from diverse population, from diverse point of view. It will help one to understand that how one can approach a patient from different cultural background from a different point of view, and also provide a new way of approaching it, a new way of medical care. So understanding the global perspective and cultural influences help the current and contemporary medical care facilities. When we look at the origin and historical background of the medical systems, I'll begin with Indian medicine. It is assumed that Ayurveda is one of the ancient systems of medicine. Its origin goes back to Veda and Upanishads, and are also found in many other treatises. And little later, it has been documented as a rational and a medical document through Charak and Susrut. Later on, a number of other medical treatises came into existence, and which talked about the ancient system of Indian medicine. And this ancient system of Indian medicine talks about the balance between body, mind, and spirit. It talks about how one can utilize natural herbs, diet, and lifestyle to change lifestyle changes for holistic healing. And so Indian system of medicine goes far back, and Ayurveda is one of its topmost medical system. It is not just about physical curing, it is about the mental balance. It is about how one can keep one's spirit in a right direction. It is about the upliftment of soul. It is not just about curing the body. In this way, Indian medical thought focuses or has a very broad concern. It has concerns about not just treating the human beings, but having a cosmic balance. It is about its concern is about the entire cosmos, where the health of human being is dependent upon the health of other non-human beings, the health of nature, the health of planetary health. So Indian medical tradition has a very broad and greater futuristic aim, which has focused upon how one can maintain and balance not just one's health, but also the health of one's surroundings. In this regard, Charak and Sushruta have given a greater contribution in terms of advanced and most rational aspect of medical practice and surgery. Other medical traditions in India are like Siddha and Unani. Siddha medicine is also one of the oldest healing traditions in the southern India, which focuses upon the transformation of bioenergy and utilizing a combination of herbal, mineral, animal products for treatments. It emphasizes how different vitamins or different types of minerals can be used to treat human beings, so that any kind of vitamin lacks, any kind of lack in the body can be improved and provided through a number of other sources. It can be natural, it can be in the form of animal products and other things. When we compare Western medicine, like Indian medicine, Western medicine has also a very old origin. It goes back to the Greek period with Hippocrates, Galen, and others. Then it further develops in Renaissance in 14th to 16th century, and then the recent concept of biomedicine has also shaped the Western notion of medical traditions. When we think about the Western medical notions we find that in the ancient time, though it has very different origin, but it also involves the use of drugs to treat ailments, and surgery provides an invasive interventions. And both the pharmacology and surgeries are integral to the therapeutic spectrum of Western medical practices. Western medical practices are also based upon observation and evidence, and it provides how clinical expertise can combine with evidence-based medicine, and it can further help in research that can ensure medical decisions, prioritize patients' care through the proven methods and interventions. When we look at the philosophical foundations of Indian and Western medicine, and the idea of philosophical foundations of these two systems of medicine goes to its cultural practices, its philosophical systems, which is prevalent in the ancient or classical times. And in the Indian context, the idea of medical care is rooted in Tridosha, holistic approach to the healthcare, and an stability between body and mind and spirit. It is about how one can maintain one's health not just in terms of physical body, but also in terms of mind, body, and soul, and that can help one to formulate one's existence and live a healthy life. In the Western context, it is more based on anatomy, pathology, and body mind dualism. In the Indian context, body mind dualism doesn't exist in the Indian medical traditions. However, though Western tradition has focused on anatomy, we cannot say that Indian tradition has not studied anatomy. When we look at Susruta Samhita, we find that he has talked about very advanced level of surgery, very advanced level of surgical tools, and also provided how these wounds can be healed. So there is a greater focus about anatomy and pathology in the Indian medical traditions, apart from Tridosha holistic approach and mind, body, spirit. The scientific methodology forms a basis of Western medicine, though it comes much later, and it emphasizes like the scientific methodology emphasizes hypothesis testing, experimentation, and reproducibility to establish medical knowledge and practices. Similarly, technological advancements and innovation significantly enhances and collaborates to promote diagnostic procedures and treatment options in the Western medicine. It leads to the improvement of patients' health outcomes and healthcare efficiency as well. Let us look back at how these two different traditions originated and what are their sources of origin. In the Indian context, it is believed that Indian medical practices originated with the magical as well as religious activities, that people used to perform magical and religious activities for curing disease and illness, including curing mental maladies and physical ailments. However, we also find that the curing and healing were also part of the religious traditions. The purpose of these religious traditions were not just about like worshipping God, but also healing the human being through different ways. And when we look at some of the spiritual texts like Ayurveda, Upanishads, and many other texts, and these spiritual shastras, they link health and health with spirituality and cosmology. It asserts that human health is dependent upon the one's spiritual practices and also with the larger cosmological universe, cosmological world. It also affirms that if a person does something wrong, if he becomes part of evil activities, then he will suffer. And the one who is not doing bad and evil activities, then they will maintain a good and healthy life. So illness and disease were seen as a form of punishment, as a form of a form of or consequence of one's karma. So the spiritual traditions believe that illness and disease are the consequences of one's karma, and hence one has to suffer. So disease is both as imbalance of dosas as well as the consequence of karma, and the way to The ways to treat them is through rituals, mantras, through priest healers, through herbal medicines, and what Charak and Susruta has talked about, different kind of what drugs, different kinds of drabyas and other things. And in the magico-religious context, human health is to be in harmony with the universe. When we look at Ayurveda, Ayurveda is one of the most systematic document about diagnosis and treatment of disease. It talks about the balance between three dosas. Three dosa means three uh, factors that cause illness, which are like Vat, Pitta, and Kapha. And then Ayurveda recommends the use of herbs, diet, and lifestyle to maintain one's health. It focuses upon how preventive and curative focus can lead one's healthy and normal maintenance of health. So Ayurveda has focused upon the holistic view of body and mind. Its focus was not only on the body, the physical aspect, but also on the mind as well as on the soul. However, after the colonial encounters, that is after the establishment of East India Company in 1601, the concept of Indian medicine became secondary. It was put aside because of the introduction and dominance of Western medicine. The Western medicine became very prominent around or in the beginning of 19th century, and that has displaced and marginalized Indian medical systems. The purpose of Western medicine was to provide immediate cure to the British soldiers and officials who were serving in India and also protecting them. Further, the Western medicine was also introduced to monitor the wealth, the natural resources, and then British surgeons and doctors can inform them to the British Empire. So British medicine or Western medicine in India has a very controversial history, and it has been not just a medium to treat and heal the human beings, the Indians or the Western officials and soldiers in India, but also it aimed to find out the resources and then communicate the same to the British authorities in India. And this British medicine, Western medicine, they positioned themselves as superior over Ayurveda, Siddha, Unani, and other medical traditions, other Indian medical traditions. The purpose, they aim to actually reveal that they have a superior, better, rational medical system, and then they began to compare that how Indian medical system lacks those superiority, those scientific inquiry. And in this way, the Western medical tradition wanted to assert its superiority and scientific approach to the medical traditions, and revealing that their concern was to heal and to help the Indian people, the indigenous people. However, the goal was not as it was declared. Rather, goal was to oppress the indigenous people, indigenous culture, and indigenous society, and at the same time to reveal and emphasize their power over the native people. So, the Western medicine came in conflict with the Indian systems of thought little later, and Western medicine has been seen as a means of control and domination in the colonial period. While we look at the Indian medicine, and it has no such histories. It remained for a long time what you call subdued, and people have less knowledge and less acceptance of Indian medical traditions. However, different forms of Indian medical traditions became global in the recent times. Whether it is yoga or Ayurveda, they were providing a holistic approach to human health. And these approaches and practices were seen as something inferior in the colonial period due to the subordination of Western medical practices. The way Indian medical system has its origin in the magico-religious traditions. Similarly, the Western medicine also originated with mystical elements in ancient Greece and Rome. We find in Hippocrates that how he talks about the intervention of Asclepius and many other gods and goddesses for in his oath, and we find that in the Western medical traditions, medical practices were part of church, and the church members, the priests were seen as healers, the monks were seen as a healer, and so in this way we also find that Christianity has a greater role in the evolution and development of Western medical traditions. They believed like they believed in the idea of sin and divine punishment, and also they believed in the idea of miracles in healing. The classical Western medicine uh, uh, were began to develop the idea of rationalism through Hippocrates, Galen, and others. Before Hippocrates and Galen, classical Western medicine was not rational. It was embedded in the idea of magical and religious practices. We also find that after Hippocrates, the notion of humorous, the theory of humors developed, and the idea of systematic observation developed, and it aimed to provide balance and moderation between health and healing, balance and moderation between different kind of diseases. And it is during the 16th century onward that we find the separation of religious beliefs and medical practices. It is almost after Francis Bacon and John Locke and many others who talked about the medical practices in their philosophical essays and books. And then they maybe Rene Descartes as well, where we find a separation of religious and medical practices. The idea of the birth of clinics and hospitals became popular. The birth of clinics then had a number of questions, and some of those questions were the clinical ethics, the birth of clinical ethics, because those clinics had a number of other practices, for example, surveillance, control, domination, as well as defining the identity of person and then leading their suppression in the society. When we look at the idea of diagnosis and cure, in the Indian medical traditions, we find pulse reading, dosha analysis, and lifestyle in the classical times. And they focused upon holistic approach, emphasizing individual as a whole, and hence they need to address physical, mental, emotional aspects to promote overall well-being and prevent disease. It also recommends herbs, panchakarma, yoga, diet, etc. The use of medicines, dietary practices, and lifestyle modifications that draw on centuries of knowledge to nurture health and treat ailments safely and effectively were also popular. In the Western context, we find that diagnosis and cure were focused upon lab tests, imaging, imaging, imagings, symptoms, drugs, surgery, and physiotherapy in 16th and 17th century onwards. The idea of cure or prevention were also embedded with the notion of dincharya, daily activities, and ritucharya, the uh, the focus upon the different seasons, how seasons affected one's health, or how daily activities have a role in one's health and healing. In the Western context, we find references of vaccination, screening, and education. And overall, the focus was on holistic or holistic healthcare facilities. And this holism emphasizes the interconnectedness of physical, mental, and emotional aspects of health, while the reductionist aspect focuses upon isolating and treating specific symptoms and diseases individually. So, in the Indian medical care, we find that the focus is on a holistic approach and that determines the interconnectedness of physical, mental, and emotional aspect of health. The Western medicine is a reductionist in the ancient times, and the focus is on isolation and treating specific symptoms and diseases individually. Natural remedies in Indian medicine often involved herbal and preventive care, herbal medicines. The preventive care prioritizes measures to avoid health issues before they arise, whereas reactive care addresses health problems after they have developed, often focusing upon treatments rather than preventions. However, such practices have changed with the advancement of technology, advancement in both Indian and Western medical traditions. When we look at the contemporary relevance of classical traditions, we find that uh, they need to be integrated in the different contexts. Both Western and Indian medicine also needs a contemporary integration, and they are integrated to a larger extent. Integrating Indian and Western medicine can lead to holistic patient care, enhanced treatment outcomes, and the potential for improved quality of life through complementary therapies. The example of such integrations include cancer treatment protocols combining Ayurveda with modern oncology, demonstrating increased patient satisfaction and better health results. WHO and World Health Organization and IUS, they talk about like how they can integrate both Indian and Western medical traditions. Though it has certain challenges in terms of its validity and providing standard medical care. And to conclude, the uh, classical Indian and Western medical care and medical traditions evolved through their specific cultural beliefs and practices with and also they focus upon the scientific advancements that were popular during that particular era. Both Indian and Western medical systems have rich legacies of medical practices. In the Indian context, if we think about Sushrut and Charak, then in the Western context, equally important are Hippocrates and Galen. It emerged from the magico religious traditions, then it focused upon the social aspects, and then got transformed into rational and scientific aspect. In these traditions, ethics and inclusion were very significant. We also find that the intersection of cultural learnings enhances human-centered care. Thank you.